All right. Good morning and welcome to the COVID-19 Emergency Response LDI Huddle Call for September 15th, 2021. We're seeing some glimmers of hope still shining through the trees. And as we hear Karen's statistics, there's some hope in there and also some hope throughout the rest of the updates. So I just want to help everybody focus on that and see that hopefully the end is near as we move into COVID key statistics with Karen.
Hey, good morning. So yes, I do have a little bit of positive news. So our 14-day positivity rate is now 20.1. Our 7-day is 19.2, and our 7-day average is 19.7. So seeing those numbers come down every day, I like seeing that. Our 10-day projected census is 166 now. Currently, we have 174 COVID inpatients. 107 of those are in full isolation. 67, the isolation has been removed. At Berkeley Hospital, they have 14 patients, 9 in full isolation, 5 the isolation has been removed. They have 7 patients in ICU, 2 on ventilators, and 3 ER holds. Mount Pleasant Hospital has 45 patients, 31 in full COVID isolation, 14 the isolation has been removed, 9 in ICU, and 8 on ventilators with no ER holds. Roper Hospital has 60 patients, 32 in full isolation, 28 the isolation has been removed, 12 in ICU, 8 on ventilators, and 2 ER holds. St. Francis Hospital has 55 patients, 35 are in full isolation, 20 the isolation has been removed, 9 are in ICU, 5 are on ventilators, and 10 are ER holds. Vaccination status is still looking about the same. 86% of our admitted COVID patients are not vaccinated. 86% of our COVID ICU patients are not vaccinated, and 87% of our ventilated patients are not vaccinated. Home care has a total of 49 patients, 46 in home health, 3 in the home hospice, none in the hospice cottage, and 48 pending admissions. Thank you.
All right. Thanks, Karen. Moving on to operations, Dr. Gallade, teammate health.
Good morning, everybody. Good morning. I wanted to give everybody an update on the exemption process. Thus far, we have 26 medical and 39 religious exemption requests that have been submitted. The panels for the medical review, Drs. Ray Fitzpatrick, Oliverio, and me, and for the religious reviews, which will be Dr. Moxley, Melanie Stith, and Mark Dixon, are getting their reviews underway later on this week. Just want to remind everybody that we have an upcoming deadline of the 17th to get their exemption requests in. And the community, the number of cases seems to be a downward trend in the Tri-County area. We hope that over the next couple of weeks that will be reflecting in a decrease in the number of hospitalizations we're seeing as well. I'm going to toss it to Sarah Dietrich to give us the workforce update.
Good morning, everyone. We currently have 65 teammates out. 19 of those are RN job titles. 33 out of the 65 are unvaccinated. We are watching 41 positive teammates. 24 of those are unvaccinated, and we have 24 in the testing process, 9 of whom are unvaccinated. Yesterday, we saw a total of 13 contacts to exposure advisor screening forms, and of those, we put 10 into our testing processes or we're following because they're positive. We released 11 teammates to return to work yesterday, and 3 of those are RN job titles, and that's all I have.
All right, thanks, Sarah. Good to hear more going back to work than coming out of work, so appreciate that update. Doug Bryan, any update on the first dose vaccine clinics?
Good morning. We're at Roper this morning in the Irene Dixon Auditorium until noon, and we'll be at Berkeley tomorrow from 7 a.m. to noon. Please help us get the word out about these first come, first served clinics.
Thanks, Doug. And I do want to reiterate to all managers, please check your lists of anybody who's listed as not being vaccinated and be sure that they either have intention of getting vaccinated or submitting their exemption process forms through the portal. And again, just want to reiterate that we do have options for previous infection being considered as a medical exemption. So please see the exemption forms for more details on that. If you have any questions, you can reach out to us at the COVID email address. Moving on to acute care ops, Dr. Segan.
Morning, Chris. I'm really excited about the good trends we're hearing this morning reported by Karen and Dr. Glade. And I will say, even with the high volumes we see, continue to be in the inpatient acute care side, I'm also super impressed by our team. As I rounded through the hospitals yesterday, just that can-do mentality, that agility, the nimbleness, just the confidence and the sense of calm in the team to continue moving forward and take care of the community. I was really impressed by that yesterday. Two things I'll continue to work on today. God, excuse me. One is that with the high volumes, we are still seeing very high acuity in the Mount Pleasant ICU. So I'll be working with critical care APPs to come forward with a solution that will be finalized and very quickly operationalized to get extended APP coverage at the Mount Pleasant ICU, which will really enhance the team out there. And then second, we'll be pushing out a final oxygen conservation protocol. And those are the two things we'll be working on today. Thanks, Chris.
Thank you, Dr. Segan. Moving on to Risa with a nursing update.
Yep, good morning, everybody. Just wanted to give you an update on our ProLink engagement for contract nurses. We did have 39 committed to show up yesterday. 36 of those nurses did come in our door, and respiratory therapists. 5 of them are respiratory therapists. So that's great news. 3 more are coming today and 9 on Friday for a total of 51. So really great news. Those are being pushed out to the various units that had the highest need. And we'll be doing an assessment today to see if we have additional bandwidth to open more space, so that those updates will be coming. And as far as the labor pool, just thank you for everyone's ongoing commitment to that, but no real updates on that. Thank you.
All right, thanks, Risa. Marcella, ED update.
Good morning. We're holding a total of 18 patients in our emergency departments today. The most is at St. Francis with 12 holds, and then Berkeley is second with 5. Mount Pleasant and Roper are doing really well, and we'll just continue on trying to place the St. Francis patients, and I've already connected with the acute care leadership to work on that today.
All right, thanks, Marcella. Moving on to physician partners operations, Jim.
Morning, everybody. Volume at Express Care has leveled out. It's still really high, but it isn't growing and it's stable. Would like to manage up all the practice managers throughout physician partners and supporting the Express Care with some of their staff. It's been very helpful, and I'm super proud of them. We are efforting vaccines into the practices. We'll have that in a little more than a week. We'll start having vaccines available, Moderna, in the primary care practices and OBGYN. That concludes my report.
Thanks, Jim. Moving on to update on the monoclonal antibody infusion updates with Dr. Oliveria.
Thanks, Dr. McLean. We have now sort of established our negative pressure for the 5th floor monoclonal antibody infusion site. We're going to be testing that, making sure that we have a good smoke test. We now have a very slick interface that allows not only our employed docs, but affiliates and community docs to refer directly into a database, and we can reach out directly and get these folks scheduled. So we're looking to start our infusion tomorrow, and we'll be able to take care of what we see to be our community need. We have had to do a little work with MUSC and get patients infused through their site at the Citadel Mall, but I think we can move all that volume back into the system. I want to manage up Ben Smith, Jennifer Clements, and Johan Enslin, really doing outstanding work on the back end, making this work. So thank you to those guys. That's all I have.
Thanks, Dr. Oliveria. So that's great work. You know, that's one of the most effective ways we can try to bend the tide on the folks coming into the hospital. Those monoclonal antibodies infusions are extremely effective, and so encourage all the managers to push that out to their providers to make sure they understand how to access that portal for registration. So thanks, Dr. Oliveria. Moving on to logistics, we have stable oxygen supplies. We continue to work on inventorying the high flow oxygen capabilities at each location. That should be finalized today. As far as materials go, we have no current concerns on any materials or PPE. Within the pharmacy, we are watching the supply of antibody infusion supplies. That has gone on somewhat of an allocation, but we are currently stable in our supplies with over 400 days of therapy available. So more to come on that if it becomes a more critical an issue. Right now, there's no significant critical issues. We're also watching some supply of some critical care drugs, but again, nothing to the level of critical supply needs at this time. Moving on to the lab update with Vanessa.
Morning. Yes, we are very happy and pleased to report that our Roche Cobas 6800 is actually installed, and the team is getting further training on it. We'll begin validations next week, and we fully expect to hit our go live date of September 27th. So everybody, our entire team is very excited. It's quite an impressive piece of equipment. The throughput on it is 1,100 tests per 24 hours. So we're very excited to start off with COVID only testing on that instrument, and then we'll layer some other tests on probably sometime in October. But we're very excited. We're ready to go with that.
All right, thanks a lot, Vanessa. Great work by the team there. Moving on to Andy Lyons with public information update.
Thanks. We'll report our new numbers. We'll also have Dr. DeLissy's commentary piece that ran in today's Post and Courier about our system sense of service and sacrifice. We'll have a roundup of all the local governments and school districts that have masking laws. Dr. DeLissy spoke at Charleston City Council last night and encouraged them to pass the law. We'll have the first dose clinics schedule. We'll also have a roundup of the entire exemption process, everything teams need to know about the mandate, and that includes a new FAQ on the issue of prior COVID infections. We'll also have an update on the booster timeline, the fact that there's an FDA meeting on Friday and then possibly a second. I know there's a lot of just system-wide and general public interest in boosters. We have non-COVID related news as well. Today kicks off National Hispanic Heritage Month. We also have pictures of Senator Tim Scott at the Waring Senior Center, and we have 3 important IS alerts. That's it.
All right, thanks, Andy. Just the updates that I'll highlight again, just for emphasis. Andy just talked about the booster process. I know there's been a lot of activity and anxiousness around getting a booster. I do want to remind everybody that the only emergency use authorization that has been done for boosters is for the immune compromised folks. But there is been some indication that by September 20th that may be expanded, and certainly healthcare workers have been indicated to be in that first round of expansion. But more to come on that. Just to let everybody know, there is supposed to be an FDA meeting this Friday to discuss that. I'm not sure if they will make the expansion at that time or not, but we are planning to be available for that and planning for that. There will be a centralized process for scheduling booster shots in the future, but more to come on that if emergency use authorization is expanded. So watch closely on Friday's update and then Monday's update for more to come on that. Also, just a reminder, surgery schedule has continued to be paused for any delayable surgeries that are not urgent or emergent that would require inpatient stay. That is currently on pause through the end of next Tuesday with the idea of hopefully restarting next Wednesday. We will be assessing the nursing staffing levels and bed availability today going into tomorrow to make a determination tomorrow as to whether or not that pause needs to be extended. So more to come on that, and watch for a distribution tomorrow of information around that. Again, as you heard through everybody who gave reports today, there was some improvement and I think some glimmers of hope shining through. And I think what I heard most of all was just the collaboration and teamwork. Through almost every update, you heard about people stretching and doing things better and more efficient and with better outcomes than we have ever in the history of our system, most likely. And I just want to say how proud I am to be a part of this team. This has been very challenging, and I know we're still in the throes and in the trenches with this, but it really does give me hope as to the resiliency of this team and the real excellence that I've seen at work. So again, appreciate everything you're doing. The team is amazing, and we look forward to a better day. Thanks a lot.